Stem cells are unique cells with the ability to develop into various cell types in the body. Known as master cells, they play a crucial role in regenerative medicine and have transformed therapeutic approaches for a range of conditions. This guide explores the science of stem cells, their applications, and the potential they hold for the future of medicine. Stem cells are unspecialized cells capable of self-renewal and differentiation into specialized cells, such as muscle, bone, or nerve cells. There are two main types: embryonic stem cells, which can turn into any cell type, and adult, somatic, stem cells, found in tissues like bone marrow, that primarily repair tissue in the specific organ. This adaptability makes stem cells a powerful tool in medicine. The primary types of stem cells used in therapy include embryonic stem cells, adult stem cells, and induced pluripotent stem cells, iPSCs. iPSCs are adult cells reprogrammed to behave like embryonic stem cells, providing an ethical alternative for research. Each type has distinct capabilities and limitations, impacting their suitability for various medical applications. Stem cells can be obtained from various sources, including embryos, bone marrow, adipose, fat, tissue, and umbilical cord blood. Bone marrow aspiration and fat tissue extraction are common methods for adult stem cells, while iPSCs are created in a lab by reprogramming cells from the patient's body. Collection requires strict processing protocols to ensure safety and effectiveness. Stem cell therapy begins with collection, followed by isolation and expansion in the lab. Once prepared, stem cells are introduced into the patient's body, where they target damaged tissues and stimulate repair. Delivery methods vary, from direct injection into the target area to intravenous administration. Post-treatment, patients undergo follow-up to monitor effectiveness and side effects. Stem cell therapy is used to treat conditions like bone and cartilage damage, spinal cord injuries, cardiovascular diseases, diabetes, and neurodegenerative diseases like Parkinson's and Alzheimer's. In orthopedics, it helps regenerate cartilage, while in cardiology, it can restore damaged heart tissue post-heart attack. Stem cells also offer potential treatments for autoimmune diseases by modulating the immune system. Stem cells are critical in hematopoietic, blood, stem cell transplants for leukemia, lymphoma, and multiple myeloma. These cells, sourced from bone marrow or cord blood, can replenish damaged blood cells after aggressive cancer treatments like chemotherapy and radiation. This therapy, often called bone marrow transplantation, is one of the most successful stem cell applications in medicine today. Stem cell therapy offers significant advantages, such as tissue regeneration, reduced scarring, and the potential to treat previously incurable conditions. As a minimally invasive treatment, it reduces recovery time and has fewer side effects than traditional surgeries. Stem cells also provide personalized treatment options, as cells can be derived directly from the patient, minimizing rejection risks. Despite its promise, stem cell therapy has limitations. It is costly, and many treatments remain experimental. Risks include infection, immune reactions, and the possibility of tumors if stem cells grow uncontrollably. The complexity of stem cell manipulation also means results can be inconsistent. Ethical concerns, especially with embryonic stem cells, pose challenges in research and clinical application. The use of embryonic stem cells has sparked ethical debates, as they are derived from human embryos. This has led to stringent regulations in many countries and accelerated research into alternatives, such as iPSCs, which are reprogrammed adult cells that do not require embryos. Ethical considerations continue to shape policies and guide the future of stem cell research. Stem cell therapy can be expensive, with costs ranging from $5,000 to over $50,000 per treatment depending on the condition and location. Factors like stem cell source, lab processing, and specialized care contribute to the high cost. Insurance coverage varies, often covering stem cell transplants for cancer but not experimental therapies, making affordability a significant barrier for many patients. The concept of stem cells emerged in the early 20th century, with the first bone marrow transplants occurring in the 1960s. Embryonic stem cells were isolated in 1998, sparking a surge in research and ethical debates. iPSCs were introduced in 2006, providing an alternative to embryonic cells. Since then, stem cell research has accelerated, making it one of the most promising fields in regenerative medicine. Recent advancements include the development of organoids, miniature organs grown from stem cells to study diseases, and CRISPR gene editing technology that allows scientists to correct genetic disorders in stem cells. Advances in 3D bioprinting have also allowed researchers to create complex tissue structures, bringing the field closer to creating lab-grown organs for transplantation. Future directions in stem cell therapy include developing lab-grown organs, refining gene editing methods, and improving patient-specific treatments. Scientists are working on growing complex organs like kidneys and hearts from stem cells. Personalized stem cell banks are another exciting avenue, where patients can store their own stem cells for potential future therapies. Did you know that fish, such as zebrafish, have a remarkable ability to regenerate their heart tissue? This has inspired studies on human heart repair using stem cells. Other fascinating findings include stem cell treatments in veterinary medicine, where dogs and horses receive stem cell therapy for joint injuries. Stem cells have even been found in tooth pulp, opening potential dental applications. Stem cells are increasingly popular in cosmetic procedures, like skin rejuvenation and anti-aging treatments, where they are believed to stimulate collagen production and promote a youthful appearance. Though largely unregulated and controversial, these treatments are gaining traction in the wellness industry. However, the efficacy of such cosmetic applications remains under scientific scrutiny. Stem cell therapy is subject to strict regulations, as treatments must undergo rigorous testing for safety and effectiveness. Many countries require clinical trials before approval, and oversight bodies like the FDA and EMA ensure compliance. These regulations protect patients but can slow down the availability of promising therapies. Balancing innovation with patient safety remains a challenge in the field. Stem cell therapy has transformed medicine, offering hope for treating previously incurable diseases. As research advances, the potential of stem cells continues to expand, with future applications likely to include lab-grown organs, advanced cancer treatments, and even genetic disease correction. The field's growth offers a promising outlook for patients and healthcare providers alike. Thank you for exploring the role of stem cell therapy in medicine. This revolutionary field is paving the way for innovative treatments, potentially transforming healthcare for generations to come.